Okay, we discussed in the previous videos the origin of the oculomotor nerve and its course in the midbrain and in the subarachnoid space, and we agreed that the oculomotor nerve takes origin from the midbrain at the level of superior colliculus, particularly from the periaqueductal gray matter. Then it moves anteriorly, it passes by the red nucleus, then it passes by the substantia nigra. Then the oculomotor nerve leaves the midbrain and enters into the interpeduncular fossa from the medial side of the cross cerebrus through the oculomotor sulcus. Once the oculomotor nerve leaves the midbrain and enters into the interpeduncular fossa, it enters below the posterior cerebral artery, as we can see, and above the superior cerebellar artery, and it moves anteriorly parallel to the posterior communicating artery until it approaches the cavernous sinus. Now we will be talking about the course of the oculomotor nerve inside the cavernous sinus, or to be more accurate, around the cavernous sinus, because the oculomotor nerve does not enter inside the cavity of the cavernous sinus. Actually, it passes by the lateral wall of the cavernous sinus. But before that, there is a very important point I would like to mention. We discussed previously that the oculomotor nerve consists of two types of fibers, somatomotor fibers and visceromotor parasympathetic fibers. The somatomotor fibers are responsible for the innervation of most of the extraocular muscles, actually all the extraocular muscles except two muscles, the superior oblique muscle and the lateral rectus muscle. And the visceromotor parasympathetic fibers are responsible for the innervation of the intraocular muscles, mainly two muscles, the ciliary muscle and the constrictor pupillae, or what we call the sphincter pupillae, which is responsible for constricting the pupil. And these two fibers are arranged together and they move as a single one fiber. The question now is, what will happen if the patient is presented with somatomotor fiber dysfunction or visceromotor parasympathetic fiber dysfunction? What will be the clinical presentation if the patient is having the damage to one of the oculomotor nerve fibers? As we just mentioned, the somatomotor fibers innervate most of the extraocular muscles. So if the somatomotor fibers are not working, most of the extraocular muscles will be paralyzed, and as a complication, the affected eye, this is the normal eye and this is the affected eye. The affected eye will look down and out with or without ptosis if the somatomotor fibers are not working. We will talk about the exact mechanism, how this happens, in the upcoming videos. But up to now, just we need to know if there is damage to the somatomotor fibers, most of the extraocular muscles, the muscles which receive their innervation from the somatomotor fibers of the oculomotor nerve, will be paralyzed, and as a result, the affected eye will look down and out with or without ptosis. Okay, what will happen if there is if the visceromotor parasympathetic fibers are not working? We just agreed that the visceromotor parasympathetic fibers innervate the constrictor pupillae muscle, the muscle responsible for constricting the pupil. So if the parasympathetic fibers are damaged, the constrictor pupillae will not work, and as a result, there will be an opposed action of the dilated dilator pupillae. So the affected eye will be dilated, will be pathologically dilated. Now we have two questions that we need to answer. We have two important questions that we need to answer. The first question is, how are these fibers arranged together? What's the anatomical arrangement of the oculomotor nerve fibers? This is the first question. And the second question is there a clinical significance of their arrangement? To answer these two questions, we need to study the microanatomy of the oculomotor nerve. We need to come and to remove a piece of the oculomotor nerve, and we put this piece under the microscope so we can see the anatomical arrangements of the oculomotor nerve fiber. So assume we come and we cut the oculomotor nerve and we remove this piece and we try to magnify this piece so we can see the oculomotor nerve fibers arrangement. We will find that the visceromotor parasympathetic fibers, the purple fibers, are arranged superiorly and more on the periphery. And the somatomotor fibers, the blue fibers, are arranged inferiorly and more deeply. In other words, the visomotor parasympathetic fibers are surrounding the somatomotor fibers, and this has a clinical significance. Whenever there is a pressure on the oculomotor nerve from the top or the periphery, whenever there is an external compression, this external compression could result from arterial aneurysms, could result from ankle herniation resulting from increased intraocular pressure, could result from a mass, a tumor compressing on the oculomotor nerve. Whenever there is an external compression of the oculomotor nerve, the visomotor parasympathetic fibers will be affected before the somatomotor fibers because of their anatomical arrangement. So the patient will be presented with visomotor parasympathetic fibers manifestation before he or she is presented with somatomotor fibers manifestation. So the patient may be at the acute onset of the disease, the patient will be presented with a dilated pupil without the extraocular muscles manifestation. So the both eyes are straight. No, the eye does not look down and outward or without ptosis. So just the patient is presented with a dilated pupil. This indicates that there is something which compresses on the oculomotor nerve, and this is what we call the surgical oculomotor nerve dysfunction, because it needs urgent surgical intervention to relieve this compression. On the other hand, there are other conditions in which the somatomotor fibers will be affected before the visomotor parasympathetic fibers, like in case of diabetes mellitus. We know that nerves they receive blood supply from small arterioles. So there is a small arteriole, it innervates it supplies the oculomotor nerve fibers. We call this arteriole the vasa nervosa. So whenever there is decrease in the blood supply resulting from diabetes mellitus or other medical conditions, the deeper fibers will be affected before the superficial fibers. So the somatomotor fibers will be affected before the visomotor parasympathetic fibers. So the patient will be presented with extraocular muscles manifestation before he or she is presented with the manifestation of visomotor parasympathetic fibers, and we call this the medical oculomotor nerve dysfunction. I hope this point is clear, and in the next video we will be talking about the course of the oculomotor nerve in the cavernous sinus, and the clinical association of the oculomotor nerve with other structures in the cavernous sinus, and the most common causes of oculomotor nerve dysfunction resulting from cavernous sinus pathologies.